Hello, dear nursing aspirants. Welcome you all to the Master Nursing classes. In the last previous crash course sessions, we have discussed the most important concept questions. By holding the one particular questions, we have discussed a lot of the important questions. Yes, beta, very good morning. Good morning, very good morning to everyone. So, who all are live to the session, so please do hit the like button. If anyone is new to the our master nursing classes family, so please do subscribe to the channel. It's completely free of cost. We are providing the a high yield, very important questions concept with a rapid revision and chanting the golden points. Yes, beta, very good morning to everyone. Very good morning to everyone. Yes, we will start the class. In the last previous class, we have discussed the most important questions on the advanced trauma life support. Along with that, we have discussed the some first aid measures in the airway obstruction, like where to do the Heimlich maneuver, how to do the Heimlich maneuver in the pregnancy, in the infants, how to give the how many back thrusts to give, how many chest thrusts to give, and most importantly, we have discussed about the triage system and color coding, and how the clinical concept questions will build up there. So what is the knowledge we have to use there? Everything we have discussed in the last previous class. So in this today's class also, I am going to discuss the very high yield questions concept. By holding the one particular question, I am trying to solve your entire doubts, questions, and particular points which will comes in your exams from that particular question, right? So here we are not only studying the question, along with that we are clearing the concept very rapidly, very perfectly, very high yield topics and questions, right? Can we start the today's class? Very good morning. We will start the today's class. I think sound and everything is clear to you people, right? Yes, we'll start the class with a beautiful motivational quote. So I have got a dream that worth more than my sleep. So you have to say yourself, your dream is most powerful and most energetic and most attractive as compared to your sleep. So when you will give the most value to your dreams, your goals, then the distractions like sleep, movie, and everything automatically it will reduce. So it is in your hand to give the preference and importance and priority for a very important things, right? So no one can prioritize your needs. You are the only person having the ability to prioritize your need, okay, because you know yourself better than anyone, right? So your dream should be more powerful than your sleep, so then the achievements become a very small thing in front of people, right? So we'll start the today's class with a beautiful question here. So please read the first question, that is, a nurse is inserting an ng tube. So what is the meaning of the ng tube? The meaning of ng tube is the nasogastric tube for an enteral feeding. So what is the meaning of the enteral feeding? Bacho, we are having the two types of the feeding. One is enteral feeding, means through the oral cavity we are inserting into the stomach. So another one is the parenteral feeding. So that is the did you people heard the word TPN, total parenteral nutrition? So here the parenteral stands here as the we are not giving from the mouth, we are bypassing the mouth and directly through the intravenously we are giving the nutrition. So this is called as the parenteral feeding. So in the question, what happening here in the question? Yes, nurse is inserting the ng tube, right? The nasogastric tube for the enteral feeding in an adult female, where she is inserting for the adult female. Okay, which size of the ng tube is most commonly recommended for this procedure? So the question is the ng tube inserting for the enteral feeding in an adult female. In an adult female, this is most important. So what is the size ng tube we have to choose here? Yes, the first one is the 6 to 8 French, second one is the 10 to 12 French, then third one is the 14 to 16 French, and fourth one is the 16 to 18 French. So I want your answer here. Fatafat bacho, please do comment in the comment box. So which is the correct answer? Yes, for the adult female, the most preferred one is the 14 to 16 French is the most preferred one for the adult female. So let us clear all the important point here. Okay, so where we have to use the 6 to 8 French NG2 for the infants. Okay, for the infants the best is the 6 to 8 French. Okay, then 10 to 12 French is the best for the children's. Okay, then 14 to 16 French is the best for the female patient, that is adult female patient, right? Very very important. Then 16 to 18 French is the, yes, guess what is the answer? Yes, that is the adult male patient. The best one is the our 16 to 18 French. So this is very very high yield question. Okay, very important question. So let me go for the next question, which is most important question. Okay, so which is the proper length of the NG tube. So, sorry, how is the proper length of the NG tube is generally determined in an adult patient. So, we are inserting the NG tube in the adult patient. So, what is the proper technique through which we can insert the NG tube? Okay, by measuring its length properly. Okay, how is the proper length of an NG tube is generally determined in an adult patient? What is the technique we are using here? Yes, option A is telling from the tip of the nose to the earlobe. From the tip of the nose to the earlobe. Okay. So only this is the half measurement. So I'm eliminating option A. Then comes to the B, from the nostrils to the xiphoid process. Directly from the nostril to the xiphoid process. So this is also improper technique. Yes. Option C is telling that from the bridge of the nose to the earlobe, then to the xiphoid process. Yes, this is the actual technique and most repeatedly asked questions in the many exams. So I have brought it in front of you people. Okay, so this is the actual proper technique to measure the length of the NG tube. Look at this one. So this is the bridge of the nose from here to the, this is the earlobe. Okay, from here to the xiphoid process. So this is the how we have to measure the length of the nasogastric tube. Okay, so very very important. This anatomical landmarks is very important to say the length of the NG tube, that is from the nose to the earlobe to the xiphoid process. Okay, so very important. The questions may strike directly with the same options in your exams. Okay, so the next question is the how is the appropriate length of an oropharyngeal airway, or we can say the Goodall airway, is determined in an adult patient. Okay, same here. Last question, we have seen that how the NG tube length is measured. Okay, so this is how the NG tube length is measured. It's an important. It's an important. Okay, so here in the next question, how we have to measure the length of the oropharyngeal airway or the Goodall airway to determine, yes, in the adult patient, the length determined in the adult patient. Yes, how to determine the length in the adult patient? Option A is telling from a ear to the shoulder. From ear to the shoulder. No, this is not a technique. We are not using this one. Okay, option B, from the corner of the mouth to the angle of the mandible. Yes. So this is the proper important technique. We have to measure the length of the oropharyngeal airway, or we can say the Goodall airway. Okay, so this is the proper technique. Okay, option C is telling from the tip of the nose to the chin. It's not a good technique. Then comes to the from the molar to the angle of the jaw. Bacho, there are two techniques to measure the length of the oropharyngeal airway before insertion for the proper size choosing. Okay, so one technique is we have to measure from the corner of the our mouth to the angle of the our mandible. So this is the angle of the mandible and this is the corner of the mouth. From here to here we have to measure. This is the one technique and this is the correct answer. Another one more technique is from the central incisor to the our angle of the jaw is the second one. Okay, but in the option D they are telling from the molar teeth. No, I would have chosen this answer if they have given this one as in the central incisor teeth. Okay, this front teeth we call as the central incisor teeth. From this central incisor to the angle of the jaw, angle of the jaw. Okay, so if they have given this option, I would have chosen this one also as a correct answer, but they have not given. So I'm eliminating the option D. So two techniques, remember, one from the corner of the mouth to the angle of the mandible. Second one is the incisor to the angle of the jaw. Okay, very important. This is how the image based questions may comes in our exams. Okay, from the yes incisor teeth to the our jaw, angle of the jaw, or from the corner of the mouth to the angle of the mandible. Okay, so very important. Here is the next question. Very important question. When inserting the NG2, which of the following position is most likely used? So during the insertion of the nasogastric tube, which position we have to use here? So option A is telling lying flat on the back with the head extended. Okay, what happening here? We have to give the flat on the back with the head extended. So if I have given the flat with head extended, I am inserting the NG2 means my posterior pharynx I am stimulating it. So when I stimulate my posterior pharynx, the gag reflex will induce. The gag reflex may induce us the vomit. So the patient is in the flat situation and the vomit comes to the mouth of the patient means there is highest risk of the aspiration. So don't give the flat position. Don't give the flat position during the insertion of the NG tube. Okay, this is not a preferred position. I am eliminating the option A. Then come to the option B. Sitting upright with the head slightly flexed. It's in perfect position. It's in perfect position we have to give during the insertion of the nasogastric tube. Most important. This is the correct answer. Sir, why? The question came here in the previous exams. Why we have to give the upright position with a slightly flexed head? Okay, upright is like this and the head should be flexed like this. Okay, so this is what we call the flexion of the head, right? So why we have to flex the head here? So that is the question they have asked in the previously one central government exam only. Okay, so the reason of the flexing head is very simple. While inserting the nasogastric tube, if you are flexing the head means your airway is blocking, means your what we can say, the trachea is blocking by the epiglottis and only esophagus will be open. So you can directly and easily insert your nasogastric tube into the esophagus, into the stomach. If I am extending like this means my airway is opened, so the nasogastric tube may go into the trachea, so there is chance. So the extension of head is not recommended. The flexion of the head is mostly preferred and recommended because while inserting the NG tube, it may directly go into the, very importantly, into the esophagus. And if you are blocking the airway, means if sometimes the vomit induced or the gastric content refluxed and it came till here means it will won't go into the trachea, so there is less chance of the aspiration also. So this is the reason, most importantly, for the easy insertion of the NG tube directly into the esophagus is the first preference answer. Second preference answer is to close the airway and prevention of the aspiration of the gastric content is the second best answer. Okay, so the best position is the sitting upright with the head slightly flexed is the our correct answer here. Okay, so then option C, lying on the left side with head slightly tilted forward, not correct one. Then come to the lying supine, again not correct one because which increases the risk of the aspiration, right? So the one more questions, let me clear the golden point chatting. So what is that, sir? Here in the last question we have seen during the insertion of the nasogastric tube. Okay, nasogastric tube insertion, nasogastric tube removal, both. For the both, the best position is sitting upright is the best position. So the second one is nasogastric feeding. Nasogastric feeding, so that may be a continuous feeding or that may be intermittent feeding or continuous feeding. The best position during the feeding, during the insertion is different, during the feeding is different. So here we can say this is the high polar position. Okay, so here we have to give the semi-polar position. Semi-polar position, most importantly बच्चों, you people have to focus over the question, what the examiner is actually asking in the question. If he is asking the preferred position for insertion, means your answer would be the high pollars with the head flexed forward. If in case he is asking the question during the ng-tube feeding, not during the ng-tube insertion, he is asking the question during the ng-tube feeding. So that may be a continuous nasogastric feeding or it may be intermittent ng-tube feeding. So what is the preferred position during the feeding, means your answer would be the semi-fowler's position is the preferred position during the feeding. It's an important, very important, bacha. Okay. So I hope it's clear for everyone, right? So here is the next question in front you people. So please do read the question completely, perfectly till the end and try to give your best answer for this particular question. Yes, that's the very simple question, bacho, and most importantly, repeatedly asked question in your previous exams. Which of the following is the most accurate method of confirming the placement of the nasogastric tube? It's important. Why? Because it's a practical related question. Where as a nursing officer you are working in the AIMS Institute, means you should know everything related to the patient care, and this question is related to the patient care. How, sir? Means every patient you are taking care in the OT, in the ICU, or in the critical care units and in the high dependency units. The most of the patients we were inserted the nasogastric tube, that is the NG tube, right? So every time before feeding, we have to check the placement of the NG tube. If the NG tube came out, means we have to reposition it properly. Then after that only the feeding is possible. Very important. So what is the most accurate method of the confirming whether the NG tube is in place or not? So the question asking like that. So your answer would be here. Yes, almost all you people have chosen the correct answer. The most accurate one is the chest X-ray. Yes. If in case here the examiner mentioned most common. Okay, the question is different here. The most common method of the ensuring the NG2 placement. Yes, it's the most common method. Every time while feeding, at least 2 to 3 times we have to feed a patient who is on the NG tube. So every time 3 times I won't send the patient for the X-ray for the confirmation of the NG2 placement. So means routine and best and most common method of confirming the NG2 placement is aspiration of the stomach content and checking for the pH. Very important. So the most accurate, if the examiner asking the most accurate, your answer is the chest X-ray. If the examiner asking routine during the feeding, the most common method of confirming the NG tube placement is our aspiration of the gastric content and checking for the pH. So what is the pH that confirms that the tube is in the stomach? Consider, bacho, this is the esophagus and this is the beautiful stomach and these are the duodenum. And as all of you know that in the stomach there is production of the one dangerous acid. The name of the acid is the HCl. Yes. So this acid makes the stomach content to be more acidic. Someone if asked the pH of the stomach, and you people have to say that is the 1 to 3 is the normal pH of the stomach. It's very acidic and acidic. Very importantly. And here in the duodenum, the content is completely alkaline. The content is completely alkaline because the glands which is present in the duodenum which secretes the mucus excessively and bicarbonates which secretes and keeps the intestine to be alkaline. right? So very importantly, so here I have inserted the nasogastric tube, means through the nose, the tube we inserted in the stomach. So if I aspirate the content, the stomach pH should be came here. Okay, if I aspirate the content, so the content will come out, and when I check the pH, the pH should be 1 to 3. Okay, if pH is not 1 to 3 and if pH is showing 7 to 8, so this is what we call as in the alkaline pH. So it would be available in our duodenum. This is the very importantly the clinical scenario based questions arises here. How, sir? How means it's very simple. As a nursing officer, you are working in the AIMS Institute. While aspirating the NG tube content, and after checking the pH, you got to know that the pH is coming at an 8.3. So what you will expect the placement of, where you will expect the placement of the NG2? Option A, it will come in the esophagus. Option B, it will come in the stomach. Option C, it will come in the duodenum, like that. Where you will confirm the answer. Yes, the pH is around 8.3, means it is completely alkaline in nature. So your answer is the NG2 is gone behind the stomach into the duodenum. Okay, so this is how we have to routinely check the placement of the NG2. Okay, so aspiration of the gastric content and check for the pH of the gastric content. If the pH is coming 1 to 2, sorry, 1 to 3, that confirms the our NG tube is in the stomach. Very importantly, so what we have to do the aspirated content, sir? Yes, in order to check the pH, I have aspirated little bit of the gastric content. So what I will do that gastric content, sir? Yes, you can flush it back. Okay, so don't discard it. You can flush it back. Very importantly, okay. So before every time feeding, consider in the morning 8 a.m. you have given the feed. Again at the 12 p.m. you want to give the feed. So before every time feeding, you have to check the GRV. Sir, what is this, sir? It means the gastric residual volume. Sir, what is this, sir? If you have given the morning 8 a.m. feed, that time the content in the stomach is completely full. Okay, so content in the stomach is completely full. Okay, so now I want to give the feeding at the 12 a.m. means I have to aspirate the gastric content back and I have to check the volume how much remaining here. So the remaining volume is called as the gastric residual volume. Okay, so if this gastric residual volume is more than 75 ml to 100 ml, if the gastric residual volume is more than 75 ml to 100 ml, then you have to hold the NG feeding. Okay, so don't give the NG feeding. बच्चों मॉर्निंग में हमने कंटेंट कुछ दिया था पेशेंट को, वी हैव गिवन सम कंटेंट और थ्रू NG tube to the patient. That particular content only still not digested and the stomach is still not empty. Again you are pouring the thing means it will overload the stomach and the content from the stomach may came out and it may lead to the vomiting or it may lead to the aspiration of the gastric content. That is very dangerous. Okay, so in order to avoid this one, we have to check whether the stomach is empty or not. Okay, so if gastric residual volume is low, means the stomach is got empty. If gastric residual volume is more, means the stomach is not empty. So previously given food is still in the stomach. Okay, so very importantly, if the gastric residual volume comes more than 75 ml to 100 ml, so hold the feeding and inform to the healthcare provider. It's very important, right? So here's the question and we have given the clear answer. The most accurate is the chest x-ray method to confirm the placement of the NG tube, and routine and most common is the checking the gastric pH by aspirating the gastric content. Okay, so here also whatever the thing we have aspirated, we have to re-inject that particular content into the stomach. Why? Because we have aspirated the hydrochloric acid. Okay, that is the HCl, and the most important our electrolyte, that is the potassium. Potassium is very rich in the gastric content. Okay, so if you are remove the content and you are throwing the content out, means you are throwing the patient potassium out and the HCl out. Okay, which makes the which leads to the acid base imbalance in the patient. So in order to avoid that one, we have to re-inject all the thing. Okay, so whatever we have aspirated, we have to re-inject into the stomach. It's an important. Okay, so hope the concept is clear here by the master, right? So here's the next question. Yes, which of the following is a nursing responsibility after administering an NG2 feeding? So what is the nursing responsibility? That is after administering the NG2 feeding. After administering the an NG2 feeding. So option A is telling that leave the patient in a supine position for 30 minutes after feeding. Bacho, you have given to feed to the patient and you are making the patient to be supine, means the content will regurgitate back and it may lead to the gastric content aspiration and the patient may go into the aspiration pneumonitis, the very dangerous type of the pneumonia where the patient will die immediately because of the some massive respiratory changes. Okay, so this is not correct answer. I am eliminating the option A. Then comes to the option A. Flush the tube with a 30 ml of the water to ensure it is clear and patent. Yes, very important. Every time you will give the feed, you have to flush the NG tube for at least 30 ml of the normal saline or at least 30 ml of the water to make the NG tube clear. Consider some ragi ganji you are giving through the NG tube. Okay, so you have given the ragi ganji through the NG tube and you have not given the flush in the NG tube. So what happens, that ragi which is there in the NG tube, it will get crystal. Okay, it will like get tight and it will block the NG tube. The one more thing, and if the NG tube is blocked, we have to remove the entire NG tube out and we have to reinsert the NG tube. Why? Because we can't give the pressure flush because the tube may get ruptures. Okay, so it's very important. In order to prevent the crystallization of the food content in the this one NG tube, so every time after giving the feeding, we have to give the flush. The question is, how much ml of the water or the normal saline we are using to give the flush? So the question answer is the 30 ml which is there in our question. Okay, so flush the tube with the 30 ml of the water to ensure the NG tube is clear and patent. It is very very important. Then the option C is coming here. Immediately change the feeding tube. Bacho, once you inserted the feeding tube, NG feeding tube, we can use that NG tube. I am not talking related to the feeding tube. Okay, feeding tube is different, NG tube is different. Okay, so this is the NG tube. That is the nasogastric tube. The image based questions may arise. Okay, and this one is the feeding tube. Okay, this is the gravity bag. This is the gravity bag, and this one is the feeding tube. So once you started using this feeding tube, so you can use this one for the period of the 24 hours only. So every 24 hours you have to change this feeding tube, and this gravity bag is also used for the duration of the 24 hours. Once you preferred the content, the food which is to feed to the patient, okay, so this feeding, the content whatever it is there inside, it may be a pizza, burger, okay, chocolate, ice cream, whatever it may be, the third class food, whatever it may be. So yes, if you have prepared, means use only it for the 4 hours. Okay, so you don't use the already pre-prepared food more than 4 hours. Okay, once the food is prepared to give the feeding, it is used only for within 4 hours. You are not using this within 4 hours, don't use this one, prefer new feedings. And remember, don't give this pizza, burger and all irritative foods through the NG tube. Don't give the cold food through the NG tube. Keep the food lukewarm. Okay, not too hot, not too cold. And the question came in the exam, As a nursing officer, you are giving the cold food through the NG tube. What is the expected finding in the patient? That is the a spasmodic abdominal cramping. Okay, as all of you know that the cold causes the spasm. Okay, like here, the suddenly whatever the food you will take, our mouth and esophagus makes, which is like a cold or a heat, which is comfortable to our body. So this is naturally happening. But when you insert some food through the NG tube, there is no changes. If you inserting the cold one, the complete cold one will go inside. If you are inserting the hot one, the complete hot one it will go inside. So which is very dangerous. So don't give the too cold, too hot food through the NG tube, which is very, very important, bacho. And the answer for this question is the very clear. That is the flush the tube with a 30 ml of the water to ensure it's clear and patent. And immediately changing the tube is not necessary. Once you are using the feeding tube, use it for the 24 hours. And most importantly, while remove the gravity bag after feeding and discard. No. So gravity bag also we can use for the 24 hours. Only food we have prepared here, so we can use that one within 4 hours. That is the very, very important. And the image based questions may comes from here, that is gravity bag and feeding tube. Okay, so and this time duration of the usability. Okay, so this will be repeatedly striked in your exams. Okay, there is chance of coming in your next exam also. Okay, so before going to the main question, here's a beautiful 30-second advertisement for you all. Okay, so whoever preparing for the RRB nursing superintendent exam, so we are having a beautiful practice session for you people, where we are preferring the high yield and very, very important multiple choice questions as a same pattern. Okay, as a same pattern of the RRB. All you people know that in the RRB nursing superintendent exam, there is 70 nursing question and 30 non-nursing question. Right? So here also we are preferring the same 70 very, very important high yield repeatedly asked question, and the question which is highest chance to came in your exam with the fully updated content. Okay, with the fully updated content. So here the non-nursing, which is including the complete RRB syllabus, which is uh, everything that is related to general English, arithmetic, maths, reasoning, and everything which is there in the RRB syllabus, we are covering and we are giving the a daily practice to you people. So if you want to choose this MCQ same pattern test series, the name of the test series which is there in our master nursing classes app is the Vande Bharat test series for RRB nursing student exam. So Vande Bharat test series is the key point to get success for your RRB exam. One important thing, and another important thing is we are having the sure selection test series. Okay, so in the sure selection test series also we are giving the beautiful content sure selection test series, that is both helpful for the Norcet 8 aspirants plus RRB aspirants. Okay, and individual Norcet 8 test series also we are having. It will be helpful for the Norcet 8 aspirants. Okay, if you want to become a part of this test series, which are very low prices, which is there in our master nursing classes app, so please do download the master nursing classes app from the Google Play Store, and the link given in the description box. From there also you can join to the our master nursing classes. Yeah, okay, directly download, and the interface shows you and which will guides you how to attempt the test, how to review the test, how to improve the marks in the test, what is important in the test, everything it will guides you very, very easily and very importantly. Okay, so then the next question is like here. Yes, the next question is like here, which is considering as an very important question. Okay, so the next question, which acid base imbalance is commonly seen in a patient undergoing the prolonged NG suctioning? So what happened? The patient is undergone a prolonged nasogastric tube suctioning. Okay, so which acid base balance we can see here? Okay, so two very important concepts I will clear here on this particular question. So that will be very much helpful for you people in your upcoming exams. Okay. Yes, I'm waiting for your answer in the comment box. Do fast comment for this particular question. Yes. So when we will do the prolonged NG tube suctioning, at that time there is chance of the metabolic alkalosis. How, sir? Yes, let me clear the concept. So that is very easy and it takes a very less time. Okay. Yes, as all of you know, this is our esophagus and this is the stomach and this is the duodenum. Okay. So this is the esophagus, this is the stomach and this is the duodenum, right? So just now only I've told that in the stomach the content is very much acidic. So when we doing the continuous suctioning, so the acid which is there in our stomach it will comes out. Means HCl will comes out. Means acidic will comes out. So the acid is going out of the body means the pH increases. Okay. So when the pH increases, we call this one as in the alkalosis. Okay. So we call this one as in the alkalosis because of the metabolite loss. There is increased pH. So we call that one as in the metabolic. We call this one as in the metabolic alkalosis. So in the last concept, I told in the duodenum, the complete thing is the alkaline. Okay. The complete thing is the alkaline. So patient is having the persistent diarrhea. Consider patient is having the persistent diarrhea means all alkaline will be get lost here. Means the this one bicarbonate and all alkaline component from the body is getting lost here. So in the persistent diarrhea, what is the electrolyte? What is the acid base imbalance happens? Means that is the metabolic acidosis. Two important, very important concepts that is striking repeatedly in the exams. Because of the prolonged NG tube suctioning, the thing which happens is the metabolic alkalosis. Because of the persistent diarrhea, the acid base balance happening is the metabolic acidosis because of the loss of the alkaline here, because of the loss of the acidic here. Okay, very important. And because of the excessive vomiting also, so same the HCl will get lost, the metabolic alkalosis will happens. What happens in the vomiting? Metabolic alkalosis. What happens in the diarrhea? That's the metabolic acidosis. Most important and repeatedly asked question. Okay. So here we are prolonged doing the NG tube suctioning because of the loss of the HCl and the acidic content. There is chance of the metabolic alkalosis. Okay. So it will be seen in the patient with a very, very importantly prolonged NG tube suctioning and prolonged vomiting also. Okay, the metabolic acidosis will be seen in the persistent diarrhea. The most important questions. Okay, and the next one is the respiratory acidosis, which will be seen in the respiratory compromised things like morphine overdose and some COPD and the acute asthmatic attack. There where we are there is less function of the what we can say the lungs means the carbon dioxide will want to go out, so which may lead to the excess accumulation of the carbon dioxide which causes the respiratory acidosis. Then respiratory alkalosis, which will be seen in the hyperventilation. Okay, where the depth and rate of the respiration will increases, the carbon dioxide excessively get lost. Okay, so when the excessive carbon dioxide lost from the body, which leads to the our respiratory alkalosis. We will see this all the acid base imbalances again, okay, in the ABG interpretation. So the most important video which will come in the upcoming sessions. Okay, so it is now the general basic thing. Remember, related to the NG tube, that is the persistent NG tube suctioning leads to the metabolic alkalosis. The concept behind this one we have discussed already here. Okay, so here is the next question. Yes, that is on the central line insertion. So before going to the central line insertion, let me discuss fadafat all the questions related to the NG tube insertion. Okay, so I will ask the question now to you people and I will wait for the your answers. Okay, so yes, be completely active in the comment box for the quick revision session here. Again, yes, first question we have discussed the size of the ng tube. The most preferred and best size of the ng tube is the in infant is 6 to 8 French. Okay, yes, quickly revise. Quickly revise. There is chance of the highest chance of the asking the questions from this one. Okay, the size of the ng tube is the in infant is the 6 to 8 French. The size of the ng tube in the children is the S10 to 12 French. The size of the ng tube in the female adult is the 14 to 16 French, and the size of the ng tube in the adult male is the 16 to 18 French. Very, very important. Then how we have to measure the length of the ng tube? Okay, from the bridge of the nose to the earlobe to the our zipper process. Very, very important. Then second method is not here. Okay, in the next question. Okay, so that is the how we have to measure the length of the oropharyngeal airway. The very, very important question. Okay, from the corner of the mouth to the okay angle of the mandible. Very important. Or from the incisor to the angle of the jaw. Very important question. Okay, so then comes to the quick revision of the next, that is the related to the position in the ng tube. Okay, yes, which position we have to give during the insertion and removal of the ng tube? There is the sitting upright position, and especially during the insertion, sitting upright position with head flexed. Very, very important in the ng tube insertion. Then during the ng tube feeding, and that may be continuous feeding or intermittent feeding, the best method of insertion of the best method of the best position what we have to give here is the, that is the during the feeding, that is the semi-polar is the always best answer. Okay, so that next one is the most accurate method we have seen the chest x-ray, and most common method, routine method we have seen, that is the aspiration of the gastric content. And here the two more points we have to we used to use two more methods to confirm the this one ng2 feeding. That is, one is the whoosh technique. Okay, so that is also previously asked in your exam, that is on the whooshing technique, and another one is the bubbling. Okay, so bubble test. Let me clear the concept. Okay, on this whoosh test and bubble test. Okay, so consider this is a patient, okay, who is lying here, and just now I have inserted consider this one is the stomach. Okay, so just now I have inserted the ng tube inside. So now what I will do, I will take a 20 ml to 10 ml syringe. I will load the syringe with air. Okay, and I will keep a stethoscope here. Here I will keep the stethoscope. Right. So with this 20 ml or the 10 ml syringe, I will suddenly push the air inside, and this from the end of the ng tube, the air is coming in the area of the stomach, means so the ng tube is in the proper place. So this technique we call as in the whooshing technique. Okay, so what we call this one? This one we call as in the whooshing technique. Very, very importantly. Okay, so then another one is the bubble technique, means that this end of the ng tube we have to keep in the bowel with water. Okay, so this is the bowel. Inside the bowel we have to keep the water, and this tip of the ng tube we have to insert inside the this bowel with water. Okay, if the bubbles are generating, bubbles are present, means the ng tube is in the lungs, so the lungs is sending the air, so the bubbles are generating. So bubbles are absent, means the ng tube is in the stomach. Okay, this is called as the bubble technique. Okay, this is also technique we used, but these two are the least accurate method. Okay, least accurate method, both the whooshing and the bubble test. Okay, so then comes to the yes, the procedure related questions on the ng tube. Yes, so while inserting the ng tube, I told the position, that is the high polar's position with the head tilted forward. Okay, so which jelly we have to use to insert the ng tube? So option they will give the amla cream, the lignocaine jelly, the water based jelly, and yes, the water soluble jelly. So which one we can use? The best answer is the previously we used to use the lignocaine jelly. So now we have to use the water soluble jelly is the most preferred answer for the jelly which is used during the insertion of the ng tube. Okay, yes, the next question is very, very important, the scenario based question. While inserting the ng tube, You are inserting the NG tube. Consider you are a nursing officer working in the EMS and you are inserting the NG tube to the patient. Now the patient is coughing. Now patient is showing the some respiratory distress. So what is your intervention here? Yes, option A, and the correct answer is this one. How means just pull out the NG tube back, wait for a second, and reinsert the NG tube. This will be your answer. Okay. So the first one, what is the priority? Just you have to pull back the NG tube because the accidentally NG tube may gone into the respiratory tract. So the patient is having the coughing and the patient may show the respiratory distress. So that time just pull back the NG tube immediately, wait for a few seconds and reinsert the NG tube. Okay. Scenario based questions, very, very importantly, it will come. Okay. Then comes to the so NG tube is contraindicated in the basilar skull fracture. If the patient is having the basilar skull fracture, if you are inserting the NG tube, means the NG tube it will go into the brain and which is very dangerous. NG tube is contraindicated in the basilar skull fracture and NG tube is contraindicated in the post-operative condition of the hypophysectomy. So what is the hypophysectomy? Yes, please give the answer. What is the hypophysectomy? The surgery name is hypophysectomy. So, which gland removal we can call that one as the hypophysectomy? Yes, removal of the our hypophyseal gland, or we can say the master gland, or we can say the pituitary gland. So removal of the pituitary gland, the hypophyseal gland, or we can say the master gland. That's what we call as the hypophysectomy. The transsphenoid approach we used to use. So what is this transsphenoid approach? Between the upper buccal and the upper lips, there is a space we call as in the middle space where we are using to the breaking the sphenoid bone and we are going to the our pituitary gland. This is what we call as the transsphenoid approach of the hypophysectomy. If you are inserting the NG tube, means the NG tube may accidentally go into the brain again. So basilar skull fracture and hypophysectomy, the insertion of the NG tube is completely contraindicated. Okay. So the next one is the most important one. Okay. So that is yes. So almost all words and key points we have discussed on the NG tube. Okay, and two more words on the NG tube. There is the gastric lavage and the gastric lavage. So if I am using the NG tube for removing the content from the stomach, means I will call this one as in the lavage. Why? Because the content is leaving the body. Okay, so that is the gastric lavage. So if I am giving something, okay, if I am giving something from the NG tube to the stomach, means that is the garbage, means giving. G stands garbage, L stands lavage. Okay, very, very important. Yes, so these are the two more important terminologies where we have to see here, right? So that is, I think, the thing is clear here. Okay, so some more practical related questions may come in your exams. So before giving the any medications from the NG tube, we have to crush it properly. Then we have to dissolve it in water. Then we have to pour in the NG tube. Okay, so if any enteric coated medicines are there, don't give the enteric coated medicines through the NG tube. Okay, so giving the enteric coated medicines from the NG tube, it actually not works. Okay, so then yes, so every time during after feeding we have to give the flesh with a 30 ml of the water. Okay, and most importantly consider this is the one medicine and this is the another medicines. The two medicines are there, you have to give with the NG tube, means so give the first medicine, give the 10 ml flush, then give the second medicine. So this is the technique you have to use. Give the first medicine, use the 10 ml flush, then give the second medicine. Okay, so this is the practical questions that may ask in your exam. Okay, remember how much ml of the water we have to use to flush the NG tube. That is the 30 ml of the water is must to flush the NG tube. Okay, so it's very, very important. Okay, and every time after giving the feeding through the NG tube, every time after giving feeding to the NG from the NG tube, we have to keep the patient in a upright or the high polar position for the 30 to 60 minutes. Okay, so you were given the feeding and you made the patient to flat, means there is a regurgitation will be there. So make sure as a nursing officer of the EMS, so you have to keep the patient in the upright position. Okay, for at least 30 to 60 minutes. Okay, very important point. So we have discussed almost all important one-liners, scenario-based questions, practical-based questions from the NG2. So let me go for the next high yield and very important component, that is on the yes central line insertion and central line CVP monitoring and the normal values, abnormal values. Okay, which lumen we have to use for the monitoring the central venous pressure and which lumen we have to use for the giving the total parenteral nutrition and which lumen is preferred for the sampling from the NG2. Okay, so what is the techniques we are using to insert the NG2? Everything. Sorry, not NG2. That is the central venous catheter. Okay, so previously just I have discussed on the NG2, so which is coming repeatedly in the mouth. Okay, don't have to worry. Yes, that is we are now discussing on the central line. Okay, so the technique to insert the central line and the all important questions we will discuss on the central line now. Okay, so the first one is, so the technique we are using to insert the central line, the name of the technique is the Seldinger technique. Okay, the Seldinger technique is the technique where we have to use to insert the central line. Very important, the central line insertion used technique is the Seldinger techniques. So what it actually involves? Option A, directly puncture the vein from the catheter. So we are taking the catheter. Okay, this is the central venous catheter. So this is the central venous catheter. With this catheter, I am directly puncturing the vein. Is it possible? It's not possible because it is an flexible plastic catheter. Okay, so it is the flexible plastic catheter. So it is not possible to puncture the central vein by using this catheter. So option A is the wrong one. Okay, so option A is wrong here. Then comes to the option B, insertion of the guide wire followed by the catheter placement. Yes, first we have to insert the guide wire. Then after that we can use the catheter insertion very easily. Okay, so this is how the Seldinger techniques works. Okay, look at this one. So this black color one is the guide wire. Okay, what you are seeing here, this black color one is the guide wire. So first we have to insert the guide wire. Along with that one, the catheter will be guided inside the our central vein. Okay, so the name, remember the name of the technique, the Seldinger technique. Okay, so remember the name of the technique, that is the Seldinger technique, where we are using to insert the central venous catheter. Okay, first we have to insert our most important guide wire. According to the guide wire, we have to insert our central venous catheter. Okay, again I am telling, remember the name of the technique, the Seldinger techniques. Okay, so very importantly, here option C is telling use the surgical scalpel to create the incision. It's not that much useful. Injection of the contrast dye for imagining, this is not an Seldinger technique. Okay, so correct answer for this question is the option B is the correct answer. Okay, so it's clear, I think so. So let us come to the next very important question. The most commonly used site of the central line insertion in adult is. The question is most commonly used. Okay, so what is the answer? What is the answer? The most commonly used. Yes, the most commonly used central line insertion site in the adults. If the examiner asking which is most commonly used in the emergency, the most commonly used in the emergency is the femoral. Which central line catheter is associated with the highest chance of the deep vein thrombosis and highest chance of the infection? Again, the answer is femoral root. Bacho, they have not asked a question on the DVT. They have not asked a question risk associated with infection, and they have not asked the question which is preferred in the emergency. So the femoral is not answer. Okay, so if the examiner asking the most commonly used in emergency is the femoral, most common route where there is highest chance of the DVT is the femoral. Okay, the common route where highest chance of the infection That is the femoral root. Okay. So now our answer is not femoral root because they have not mentioned anything in the question. Okay. Yes, they have mentioned most commonly used site for the central line insertion in the adult, and the most commonly used site for central line insertion in the adult is the right internal jugular vein, bacho. Okay, in the option they will give the left also. Don't give the answer is the left. Always choose the answer is the right internal jugular vein is the most common vein to insert central line catheter. So then come to the option C, the subclavian vein. So here the subclavian vein means we are inserting the catheter through the subclavian vein. So this is used in a TPN. Okay, most common used vein for the total parenteral nutrition administration is the subclavian vein. Okay, yes, is that clear, bacho? Yes. So look at this one. Look at this one. Okay. So now choose the answer. Okay. So this one is the right jugular one. I am giving the option as an A. So this is the subclavian catheter. Okay. So this one is the subclavian catheter. I am giving the option. This one as a B. So this is the our femoral catheter. I am giving the option as in the C. So this is our PIC line. That's the peripherally inserted central catheter. Okay. In the Norcet only asked what is the full form of the PIC line? Okay, what is the full form of the PIC line? That is the peripherally inserted central catheter is the full form of the PIC line. Okay, so very important. Okay, so I'm giving the PIC line as the option D. So just I will ask the question. You people have to choose the answer. Okay, yes. The preferred site of the CVP insertion most commonly in the adults. The preferred site of the CVP insertion most commonly in the adult. Okay, the preferred site of CVP insertion most commonly in the adult is the yes option A. That is the our right internal jugular vein is the most important and preferred route of the central venous catheter insertion in the adults. Okay, so then next comes to the yes, the most common site of insertion of the CVP for the total parenteral nutrition administration. Okay, for the TPN administration, the total parenteral nutrition administration, the best line is the preferred line is the our subclavian vein is the preferred vein to administer the total parenteral nutrition. Okay, so most commonly used in the emergency is the femoral. Okay, emergency is the femoral. Highest chance of the DVT in the femoral and highest chance of the infection also in the femoral. Okay, so frequently asked questions. Okay, yes, almost all our point is clear here, right? So one more question: if you are inserting a central venous catheter in the emergency, okay, and the patient suddenly getting the respiratory distress, okay, so consider these two are the lungs. Okay, here will be our lungs, right? So while inserting the subclavian catheter, if the patient is having the suddenly respiratory problem, means this catheter may accidentally penetrate the lungs. Okay, so the accidental penetration of the lungs, and there is highest chance of the pneumothorax is associated with which of the following central line insertion site? Yes, the pneumothorax is highestly associated with the subclavian vein insertion, and that is what. So, in the emergency, if we are inserting the subclavian catheter, means there is chance of the pneumothorax. So, not preferred in the emergency. That is the subclavian is not preferred in the emergency. Okay. Yes, the most important question. Okay. So, all golden point chanting we have done in the last question. Okay. So, the next one is the yes. What is the normal range of the central venous pressure? Very simple and important question. Okay. So don't neglect anything because which creates the confusion for you people in the exam. Okay. So what is the normal range of the central venous pressure? Yes. I'm waiting for your answer in the comment box. Fadafat do comment in the comment box. Bacho, I'm waiting now. Right. What is the normal range of the central venous pressure? The normal range of central venous pressure is 2 to 8 mm of Hg according to the option. Bacho, in some books it's given 3 to 8 mm of Hg. So the both is correct. Both are correct. So according to option, you people have to act in the your exams. Okay. So if the examiner asking what is the most what is the normal intraocular pressure? Okay, what is the normal intraocular pressure? What is the intraocular pressure? The pressure which is there inside the eye, which is created by the aqueous humor fluid. Okay, yes, the question which is there inside the eye, which is created by the aqueous humor fluid. So that is what we call as the intraocular pressure. The normal intraocular pressure is the 10 to 21 mm of Hg. Remember, the instrument used to measure the intraocular pressure is the tonometer is the instrument where we are used to measure the intraocular pressure. The normal intraocular pressure is yes 10 to 21 mm of Hg. Okay. So the next question is yes, what is the normal intracranial pressure? What is the normal intracranial pressure, bacho? Yes, please do comment for the question what I am asking here. So what is the normal intracranial pressure? Yes, the 5 to 15 mm of Hg is the normal intracranial pressure. That's correct answer. Okay. So what is intracranial pressure? It's the pressure which is present inside the cranial cavity. So that is called as the intracranial pressure. So that may be due to the tumors in the brain. That may be due to the overload of the our CSF. That is the cerebrospinal fluid in the brain. Okay. So that increases the intracranial pressure. Okay. Most commonly, increased ICP we will see in the patient with the head injury. Okay. So that is the clear concept here. Okay. That is the clear concept here. So then now comes to the so what is the normal pulse pressure? So what is the normal pulse pressure? The 40 mm of Hg is the normal pulse pressure. What is the pulse pressure? Okay, SBP minus DBP is equal to pulse pressure. Okay, so it's a difference between the systolic blood pressure and diastolic blood pressure. It's called as the pulse pressure. So okay, so what is the normal SBP? Okay, what is normal standard SBP? That is the 120. Then what is the normal standard DBP? That is the 80. So 120 minus 80 is the 40 mm of Hg. So this is our normal pulse pressure. Yes, let's quickly revise that one. What is the normal intraocular pressure? Sir, normal intraocular pressure is the 10 to 21 mm of Hg. Okay. So then comes to the next question. What is the normal intracranial pressure? That is the our normal intracranial pressure is the 5 to 15 mm of Hg. Okay. So then comes to the next question. So what's the normal central venous pressure? Okay. Normal central venous pressure is the yes 3 to 8 mm of Hg is the normal central venous pressure. Then comes to the what is normal pulse pressure? That is the 40 mm of Hg is the normal pulse pressure. But so very importantly, all definitions we have seen and some important points we have seen on the pressures. Okay. So here's the next question. Okay. Let's discuss this question. Very important question. Okay. Yes, don't worry, बच्चों मैंने वादा दिया I will cover all important topic. Definitely I will cover all important topic. And one more important thing for you people. Yes, don't neglect the non-nursing. The Sunil sir covering the complete non-nursing for your Norcet 8. Okay, so tomorrow the current affairs video will come. All the important points from the current affairs. Sir have created such a beautiful video for you people. So once you people have see that video, yes, definitely you will definitely strike that particular questions if comes in the exams directly. Okay, so yes, such a beautiful class sir will conduct in the tomorrow session. Okay, so most probably if possible today only we will release, if not possible tomorrow morning as usual in the regular time we will release the our class. Okay, so don't worry about that one, right? So yes, the question is here, when performing the central venous pressure monitoring, okay, when performing the CVP monitoring, the position of the patient should be ideally, okay. So question is not related to while inserting the central venous catheter. The question is related to during the monitoring of the central venous pressure, okay. So which is the preferred position as a nursing officer we have to keep the patient, okay. Yes, the question is very simple. You are taking care of the patient where the patient is having the central line catheter. Now you want to monitor the pressure from the central catheter. Okay. So most importantly, which position you have to give to the patient during the monitoring of the central venous pressure. Okay. So your answer is yes. Option D, lying flat with no elevation of the head. So this is answer which we have seen in patient to manage the post puncture headache. Okay, so post epidural puncture headache means just I have punctured the spinal cord where the CSF is leaking. Now the patient is getting the excessive headache. So which position to be given in the post epidural puncture headache? So that is in the post epidural puncture headache. So the proper position is the flat position with no head elevation. Okay. So then option C, prone with the head turned to the opposite side. So prone position with the head turned to the opposite side will be given in the client with the palatoplasty. What is the palatoplasty? The palatoplasty is the surgical repair of the cleft palate. Now I'm not talking about the cleft lip. This is the cheiloplasty, repair of the lips in the cleft lip. That is the cheiloplasty, repair of the palate. The palate inside hard palate, soft palate. Did you people heard? Yes, the if there is gap between the hard palate in the newborn congenital anomaly, that is what we call the cleft palate. Okay, if I repaired that cleft palate as a post-operatively, I have to keep this particular baby in the prone position with the head turned to the one side. If any secretions coming, it will comes out. Okay, it's preferred position in the palatoplasty post-operative, the option C. It's not preferred for the CVP monitoring. I am eliminating both option D and C. Then coming to the option B, sitting upright with a 90-degree angle. It's not in good. So this position we have to give in a patient with the yes sitting upright with 90-degree angle and leaning forward. This position yes is called as in the cardiac position where we are giving in a patient with a COPD, right? So please mention the another name of the cardiac positions. So where we are giving in a patient with a COPD. Yes, do comment in the comment box. Okay. So then comes to the next, the correct answer for the our this particular question. While monitoring the central venous pressure, the position to be preferred is the supine position. Supine position we have to keep with the head of the bed elevated 30 to 45 degree is the correct and proper correct answer. So this is the correct answer to monitor the CVP. So we have to keep the patient in the supine with the head of the bed elevated. Just not only we have seen this question, we have seen the other unrelated questions that is very much relative for your Norcet exams, right? So yes. So the next one is the my concept based questions. Which lumen we have to use to monitor this particular things? Okay. So there are three lumens in the central venous pressure. The Dur one is the distal lumen. This is the distal lumen. This is the median lumen, and this one is the proximal lumen. ओके सो जो बॉडी से दूर होगा तो उसको डिस्टल बोलेंगे मीडियल इज द मिडल वन एंड प्रॉक्सिमल इज द पास वन ओके जो बॉडी के पास में होगा उसको प्रॉक्सिमल बोलेंगे जो बॉडी के दूर में होगा उसको डिस्टल बोलेंगे ओके वेरी सिंपल थिंग ओके राइट सो which one we have to use for this CVP monitoring okay for the central venous pressure monitoring the preferred lumen or the loop we have to use is the this is the distal lumen we are using for the CVP monitoring. How sir? How means yes for the monitoring the central venous pressure the tip of the tube should be in the our right atrium or in the superior vena cava okay so very importantly where the placement of the tube should be it should be in the right atrium or in the superior vena cava. So among these three lumens which lumen is directly and first exposed to the right atrium that is our distal lumen which is completely exposed and perfectly exposed to the our right atrium. So the blood pressure which is coming here which will be directly implied on the our distal lumen only. So to monitor the pressure the best lumen is the our distal lumen and to give the yes total parenteral nutrition. So to give the total parenteral nutrition the best one is the median lumen okay so median lumen is the best one for the total parenteral nutrition. Very importantly these questions only asked will exams okay so nothing other than this okay for the routine sampling which lumen will be used so that is our proximal lumen for the yes let me clear this one okay so the proximal lumen is used for the sampling the median lumen is used for the total parenteral nutrition and the distal lumen is used for the central venous pressure okay so let's quickly revise yes that is the distal lumen perfect The proximal lumen, perfect. Then comes to the median lumen, total parenteral nutrition, perfect. Okay. So this question is very, very important question. Okay. So some eye irritation because of the system. Uh, this content preparation took my around 7 hours to prepare this content. I took around 7 hours because everything images, everything need to type and prepare to deliver the content very easily. It's very challenging to me also. Yes. So if any one of you are watching with a true heart, so please do subscribe to the channel. Okay, and share this video in your WhatsApp status. If you have any your college groups, in your nursing friends group, okay, and if you are working as a professor, clinical instructor, tutor anywhere in the India, if you are watching my class, so please do share this class in your all the WhatsApp groups, Telegram groups. Okay, so keep it in your WhatsApp status, so it will helps us to build our community, and it will actually motivates me. Okay, if my followers are increasing, if my subscribers increasing, and if getting more views on the videos, means it actually boosts me to create the valuable content towards you people. Okay, so that is the reason, right? So we are get giving the quality time for you people, means yes, you people have to do something help to us also. Okay, so yes, the request is to keep the this particular video session in your WhatsApp status, so that the interested candidates, the true aspirants, if they are struggling to crack the exam, means they can take use of this free crash courses also. Okay, so yes, so yes, the eyes are clear now. Give me a second please. Right. So we have clear with this one. So the next question is here. What is the potential consequence of not aligning the transducer with a phlebostatic axis when measuring the central venous pressure? Okay. So what happening here? We are measuring the central venous pressure. This is the manometer. Okay, the instrument used to measure the central venous pressure is CVP manometer. Okay, previously to measure the intraocular pressure, I told the instrument name, that is the tonometer. That is not manometer. Don't confuse. That is the tonometer. Here, for the measuring the CVP, we are using the manometer. Right? So it's important. And this is the 0 point of the manometer, or we can say this is the transducer of the manometer. So this 0 point, or we can say the transducer, should be at the level of the our superior vena cava and right atrium. So this particular superior vena cava and right atrium position we call as the superior vena cava. Vena means veins, right? So veins means we can say flub, right? Flub means phlebitis, thrombophlebitis. Okay, what it indicates? Flub means the vein here. So it is at the level of the superior vena cava. So this one what we call as the phlebistatic axis. It should be at the level of the phlebistatic axis. So this is our transducer. It should be at the level of the phlebistatic axis. The next question is, what is the exact location of the phlebistatic axis? That is the fourth intercostal space, mid axillary line. So this is the exact location of the our phlebistatic axis, and our transducer or the zero of this manometer should be at the level of the phlebistatic axis, or at the level of the fourth intercostal space, mid axillary line. It is very, very important. What happens if I keep this zero above or below the phlebistatic axis? It will give the falsely high or low readings. Okay, it may result into, the question is asking simply that one only. Okay, so what is the potential consequence of not aligning the transducer? Means we have to maintain the alignment like this. Okay, this zero should be at the level of the phlebistatic axis. If we are failing to maintain the alignment, okay, we are not aligning the transducer and phlebistatic axis, so When measuring the CVP, it may lead to the results in the falsely high or low CVP, okay, because of the hydrostatic pressures increases here, okay. So that is the correct answer for this particular question, okay. So here is the next question. So do read the complete question, then try to give a best response to this question also. Yes, the question is very simple. The chest tube insertion site, the chest tube you have inserted in a particular site for draining the hemothorax is typically located. Yes, this is the now question started on the chest tube insertion. Before going to chest tube insertion, let me फटाफट review the questions on the CVP monitoring, so that will helps you to clear the more questions in your exams. Okay, again, rapid revision and golden chanting here. Yes, the first question is the preferred site of the CVP insertion. 100 time revised, that is the right internal jugular vein. Then the most common site of insertion of the CVP for the TPN administration, that is the subclavian vein. Okay, so the next one is the most common site with the least risk of the infection. Yes, this is the another one more important point, that is the subclavian vein is having the least risk of infection. The most risk in the femoral, second is the internal jugular, the third is the subclavian. Least risk of the infection is in the subclavian. Okay, and most importantly, high risk of the pneumothorax will be seen in, yes, high risk of the pneumothorax will be seen in the subclavian vein. Yes, if you are inserting the catheter through the subclavian vein, there is high risk of the pneumothorax. Okay, so then comes to the most common site of the highest risk of the infection and DVT. Many times told highest risk of the infection and DVT in the femoral root. Okay, so then comes to the patient positioning during the monitoring of the CVP is the most importantly, patient positioning during the monitoring of the CVP is the supine position with the head of the bed elevated 30 to 45 degree. Okay, this is the correct answer. If the question is coming, what is the most common route we have to use during the insertion of, not during the monitoring the CVP? You are inserting the central venous line through the subclavian route and through the internal jugular route. Okay, so during the insertion of the CVP line, the preferred position is Trendelenburg position. Okay, means where the head we are keeping down and the foot we are keeping up like this. Okay, why? Because all of you know this. This is the head, means the venous supply. This is the head, means the venous supply will be like this, right? This is how the vein drains. Okay, now if I am making this head down, means the vein will not drain properly here, means here veins will get big and enlarge here, so I can easily palpate the vein and I can easily insert the central catheter. Okay, so that is the reason we have to give the patient the Trendelenburg position during the insertion of the internal jugular catheter and during the insertion of the subclavian catheter. Very important. The first one is to make the easy visible and easy insertion of the catheter, one point. And the second most important point means during the insertion of the central catheter, if accidentally air enters into the veins, means this position holds the air at the site only. Okay, it will not allow the air to move on. Okay, so if by mistakenly air enters inside the vein, so keep the patient in Trendelenburg position to the left lateral position. Okay, so keep the position head down to the left lateral position. This is we have to give the position during the prevention of the air embolism during the insertion of the CVP. Okay, so most important point we have discussed while monitoring the CVP, supine with head of the bed elevated 30 to 45 degree, and while insertion of the CVP line, Trendelenburg position is the most important position. Okay, so yes, again the most important golden point revision here. Okay, so the next position is the most common site of insertion of the PICC line. Okay, yes, this is also very important. So most common site of insertion of the PICC line. Okay, so that is the peripherally inserted central catheter. So that is our basilic vein. Okay, so let me clear here. This is the PICC line. So this is the peripherally inserted central catheter. The most commonly site is the, remember and note it down, our basilic vein. That is the median basilic vein. Okay, So let me cover here. So this is the median basilic and this is the lateral basilic. So this one is the most preferred vein. Okay. So that is the median basilic vein is the best preferred vein for insertion of the CVP. In the image they have inserted opposite side. Okay. Don't go according to image. What I am telling, that one you people have to monitor. Okay, that is the I note down. Median basilic vein is the most common vein. Here we have to insert the PIC lines. Okay, it's the most important. Then we have discussed the Seldinger techniques. First insert the guide wire, then insert the catheter. Okay, so it's most importantly we have discussed. And so again, in order to reduce the infection, we have to clean the area. We have to clean this particular area where we are inserting the CVP line. Here I am inserting means I have to clean this area with a 2% chlorhexidine solution. Okay, 2% chlorhexidine gluconate solution. Very important. Very important. So solution used for the cleaning the site of the site of the CVP insertion is the 2% chlorhexidine solution, and we have discussed the most important position also. Yes, that is the correct one and very important one. Okay. So the next golden point chanting. If I am not using this CVP line, so how often I have to give the flush to the CVP line? Okay, I have inserted the CVP line, but I am not using that one now. So every 24 hours we have to give the flush in the CVP line, and preferred fluid is the normal saline 0.9 percentage. We have to use to give the flush. Okay, so which syringe is used to give the flush means 10 ml syringe is the most preferred syringe to give the flush, and the most important fluid which we are preferring to give the flush is that is 0.9 percentage normal saline. And how much ml? 10 ml. Which ml syringe we have to use? That is 10 ml syringe we have to use to give the flush. Okay, so very important, right? Right. So during the giving the flush in the central venous catheter, we have to maintain one technique. The technique name is the push, forge, push technique. Okay. So technique name is the first we have to push the NS, push, then wait. That is the force. Means wait for a second, then again push. This is what we call the push, pause, push technique, or we can say the pulsatile technique. What is the meaning of pulsatile technique? Yes. So if people while feeling the pulse, it will rises then down, then rises then down. Means push, wait, push, wait, push, wait. Okay. So that is the pulsatile technique or the push, wait, push technique we have to use during the giving the flush into the central venous catheter. Okay. So very importantly, yes, if the central vein is not in use for the last 24 hours, so give the flush every 24 hours. Okay. Very importantly, right? Yes. So next come to the addressing in the CVP line. Okay. So yes, this is here. I have inserted the central venous catheter in this vein. Okay. So now I am having the gauze dressing here. Okay. So this is the gauze dressing. Gauze pad dressing I am having. So how often I have to change this one? So if you are having the gauze dressing already discussed, Q2H means every second hourly. Every second hourly change the dressing. Q means every. 2H means second hourly. Okay. So every second hourly we have to change the dressing if it is so sorry. Every second day. Okay, not Q2H. Please make a correction here. It's an every second day. Okay. So every second day we have to change the dressing if it is gauze piece dressing. Okay. So then comes to the next one, that is the transparent tegaderm. Transparent tegaderm dressing means whatever the dressing you are having here, that is transparent. So you can see the particular CVP line here because this dressing is transparent. Okay. So means this transparent tegaderm dressing is there means you have to change the dressing. Yes, every 5 to 7 days. Okay. So then again one more thing came. If the dressing is visibly swirled, if the dressing is visible swirled, change the dressing immediately. Okay, change the dressing immediately. Okay, so we have discussed the most important chanting of the golden points. Okay, which will be very much helpful for you people in your upcoming exams, right? Yes. So almost all important things on the CVP line we have discussed. So let us go to the next session, that is on the chest tube insertion. So this session I will cover in the next video. So the next upcoming videos length will be somewhat long and somewhat prolonged, because to cover the all high yield and important topic for your upcoming exams. Okay, so stay connected, stay motivated, keep preparing. If you people having any doubts on this particular topics and high yield of very hot topics which I have covered today, so if you people having any doubts, means to please do mention your doubt in the comment box, so I will clarify your doubts definitely. And one more very important thing, so if you are watching my videos since from the first video, yes, so please do share video with your all college groups and friends and everywhere, so that will help helps us and motivate us to deliver the high yield content to you people. Okay, so yes, and thank you for the very beautiful response from the day one of the video to till here. Yes, so I will definitely strike my maximum in your Norcet exam. It's my promise to you people. Okay, and next in upcoming videos, or to cover the all huge syllabus and very important syllabus, there may be a chance of the two videos in a per day. Okay, so and the video's length will be somewhat lengthy. So definitely I will try to cover all the high yield component and concept that is much necessary for your exams. Okay, so please do subscribe to the channel if you are first time. And as I told previously only, so we are having a very beautiful app where we are giving the very high yield and highest quality content in the form of the test series. Okay, so if you are still not a part of that test series, so please do download the Master Nursing Classes app. Both link and this one, what we can say, the Play Store app link I have given in the comment box and the description box both. Okay, so you can download from the anywhere. Okay, and we are having the beautiful YouTube channel. Along with that, we are having the WhatsApp groups where the 3000 plus aspirants are clearing their doubts on the daily basis, discussing their questions on the daily basis. And we are having the most important Telegram group where we are sending the quiz on the daily basis for the RRB exam and Norcet exams. Okay, so we are continuously engaging with you people to give you a quality content and the correct content that decides the rank. Okay, so if you want to be our Telegram group and WhatsApp group member, it's free of cost. No single 1 rupees charge will be there. It's completely free of cost. Okay, I will give the description link in the description box and in the comment box also. Yes, if you like this video, please send 3 thumbs up. Okay, everyone, please send me the 3 thumbs up in the comment box, so that will help us. Okay, yes, so we'll meet in the next session. तब तक के लिए जय हिंद, जय भारत. No time waste, full perfect start for the Norcet, right? So we'll meet in the next session. Thank you so much.